Hello, 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 performance medicine viewers and listeners. My name is Andy. I'm not your usual host for Outside the Box, but I am your host today. I'm the PA that is in the Johnson City location, and I am here with our brand new, not new PA, but brand new to us PA, Jill Henritze.
Thank you for the lovely intro.
Yes, thank you so much. And also, too, I've been practicing Jill's last name for the past 5 minutes, 5 seconds. Hen, then Ritz Cracker, and then E. I've known her for a long time, but I have been too nervous to ask how to pronounce her last name. So there we are. Now that we know. And welcome to Performance Medicine.
Thank you. I'm proud to be here.
Yes, and welcome to the Bristol location. We are in the front office of our new office location down on Bristol on State Street.
Yes.
So we're excited to be in Virginia, excited to be in Bristol, and I hear what they say. It's Bristol, baby. Is that right?
That's right. And the race was just, 2 weekends ago?
Yeah.
So, it was a whole lot of action going on
Could
down
you
here
hear
on State
anything
Street.
on State Street?
Just commotion of people.
Commotion.
But, so...
Well, we are so excited. This is Jill's first podcast, first YouTube, first show with us, and this is her introduction into the world. Jill has been a PA for a long time with a background, first off, a background in surgery and a long time in orthopedics.
Yes.
And we have stolen her from traditional medicine and convinced her to come over to the good side. I'm just kidding. Traditional medicine's great. But now has made the transition into integrative health, and we're excited to have you. Mm-hmm. So we just kind of wanted to see, tell us a little bit about yourself, Jill. This is Intro to Jill.
Okay. So definitely the last name is hard. We went through that already.
We did. Yes. Yes. Listen, but I learned Hen, Ritz like a cracker, E.
That's it. So I have been a PA for a long time, as you mentioned, 20 years. Hard to believe that. Was in orthopedics for the past 16 years and have really had a really special interest in osteoporosis in the orthopedic world. And thinking about that, you think about prevention and lifestyle change, which matches with integrative health. Personal history, I had ovarian cancer at a young age, at 32 actually. So it's been a few years ago now, and that really kind of opened my eyes to integrative medicine because you're going through so many things, healing from that and treatment, and what can I do to prevent these things from happening, number one, and how do I become the best version of myself going forward? And that started me looking into integrative medicine in more detail. And that interest has grown for personal reasons and then reaching out to patients on many levels, because as we know, prevention is the key to so many things, and lifestyle modification to so many things, thinking about osteoarthritis and patients that, again, obesity is a huge problem in the orthopedic world.
Right.
So all of those things tie together really with getting to the root cause, which a lot of times can be simple things that you can do to better your health that lead to less medications and less surgeries and less pain and better lifestyle. So
and too, it's you've kind of had such a widespread, you've cast a wide net in your history, not only professionally, but personally too. Yeah. That makes a huge difference whenever we come into the room. Me being a type 1 diabetic and my sister having type 1 diabetes, I get very near and dear to anything that's insulin or glucose related. The same must be true for you as well.
Sure. Yeah. And so you're thinking about getting in the postmenopausal world, right? So that was something that I was thrown into with surgical menopause and dealing with all those symptoms. So yes, I definitely feel like I have a, personal experience and, the need to, hey, we can make you feel better. This isn't your just accept it and go with it.
It's not the end.
It's not the end. There's another side, and you can get there with some things that you can do, whether it be hormones or not. There's lots of different options.
It's so interesting too. So surgical menopause, that just means that it's acquired. Mm-hmm. We've removed the primary target organ for progesterone, which is the uterus. Sometimes the ovaries get left behind. Sometimes they're taken out as well, which makes your primary female hormones estrogen and progesterone.
Right.
That is a lot of our patient population dealing with variations within those hormones. Mm-hmm. To get thrown into it so quickly and so robustly at an early age too, it must have been scary. I mean, it must have been a little scary.
Sure, it was scary. And I was going through chemo treatments at the same time, and also thyroid issues. with,
Yes.
Hashimoto's. I have that too. So all of those things together, and you're like, well, what symptoms are coming from what? Because you have so many things going on.
And it's an umbrella. It's an umbrella that has so many spokes that kind of come from that same source. Interesting. So tell me too, you've also practiced in different parts of the country as well. You trained up at Yale? Is that
I did.
Right.
Yes.
And primarily, first was Roanoke? First was Roanoke, then Yale.
Yes.
So kind of go over that with me.
So I'm originally from Southwest Virginia, from Grundy, Virginia. A lot of people in this area come to Bristol and are from. I've seen a lot of patients from Southwest Virginia already, so that's pretty cool. Went to College of Health Sciences in Roanoke, Virginia, and then I did a postgraduate residency program up at Yale, and moved back actually to East Tennessee after that.
That is awesome. And two, the transition coming from surgery into orthopedics. What kind of made you make that jump? And was it something that you're intending or something you're interested in? Kind of.
A little bit circumstantial, some of it. General surgery was kind of my first love going through PA school, and then I did my postgraduate residency was a little bit more surgical oriented, although we did orthopedics and all surgical subspecialties while I was there. And then I worked in general surgery for about 3 years, and the physician that I worked with, who was great, I loved him, he had some health issues and was kind of starting to get into that slower mode or the retirement mode.
Right.
And so it was like, okay, I think I've left my time here. I've learned a lot, but I need to move on. And kind of circumstance brought me into orthopedics. It was a position that was open in the area. I knew some of the physicians there already. I worked with one of them at the hospital where I did general surgery on occasion, kind of helped him with some small cases. And so that kind of got my foot in the door. And I was interested, of course, in still doing surgery and the procedure part of orthopedics, joint injections, and those types of things. So that's really got my interest into orthopedics. And then once I started with it, of course, I loved it. I stayed in it for years. And then after doing that for, I guess, 5 or 6 years, I really became interested into osteoporosis.
Right.
And treating the females in the area, because we're seeing so many fractures, obviously in orthopedics. And those fractures most often are in elderly patients that are osteoporotic related. And that was going untreated. So I really saw the need for it, and got a special interest and special education in that, and started tailoring my practice more towards osteoporosis prevention and treatment.
Yes, and two, the lead in this area for it, there's not a lot of people who specialize specifically in the treatment, prevention of osteoporosis, osteopenia.
Right.
And so, we've got an expert on board now at performance medicine, which is
Right.
awesome too. And you're going to bring some of the stuff that you did in your osteoporosis care as well.
Absolutely.
And two, we're going to have another podcast on that. So this is all about Jill. So we'll talk about osteoporosis, osteopenia later. But we're thrilled to have you too. Now, so we've gone from surgery. First off, Jill throws a mean pellet. Oh my God. Like throw that pellet in like butter. You won't even know it's there, which is awesome too. So it's nice that too, you've had such experience with your hands. I think it makes such a difference too, to be that hands-on. We have a few procedures at performance medicine too. We do a lot of aesthetics. You can't notice now, I can't move my face as much because Jill has frozen my face.
And it's so beautiful.
And it's so beautiful and timeless. I have turned 60 years old now. You would never know thanks to Jill. But one of our big procedures is pellets and hormone replacement pellets. So that's super, super exciting. Now we've gone from surgery to orthopedics into integrative. Now, two, what kind of made you decide to make that jump? Even when we were talking kind of in the initial stages of Jill coming over to performance medicine, it's a big jump. It is a big jump. It's very different from traditional. I bypassed a little bit of steps just from family connections, right? Nepotism, going straight into integrative health. But it's different going from the traditional world right into integrative.
It is. It really is. And it's intriguing because once you kind of start reading more, and you just want to continue to learn and grow.
And it's evolving. It's always evolving.
Always. And so, of course, spending time with your dad, he's a wealth of knowledge, so that's pretty amazing. You are too.
Yeah.
Everybody
by proxy.
Everybody works together really well, reaching out to our other providers that are kind of have their niche, let's say, or their specialty, which is great. But it has been a very exciting change, actually. The patients are really interesting, and the thing that I have enjoyed so far the most would be really having the time to listen to the patient and listen what the patient really needs or wants from the visit, And I think that has been maybe the most beneficial change and the most positive change that I've seen. Because how many times, and I'm certain you hear it a lot more than me because you've been here longer, but I've already heard a lot. Like, I've gone to my primary care provider or whoever it may be and said, I feel this certain way. I just don't feel good. Something's off. And they do some lab work and they say, well, everything looks fine. We'll see you next time.
Yeah.
And then it's like, but I still don't feel good. So something, what else can you do? So it's taking that next step and listening to the patient, maybe delving a little further into more blood work or more workup, or maybe just actually offering them some options of, well, these are some simple things that you could do that I really think would make a difference. So yes, that has been my most, I think, enjoyable change.
That's awesome. Yeah. And two, I feel like we take it for granted sometimes that even in the traditional setting, sometimes there's just not allotted time. You can't, sometimes you are really only allotted 5 minutes to say, I have to move on because people are coming in a lot. So it's sometimes I don't really, it's not the provider's fault, but in a setting like this, we're just allotted so much more time to sit and talk and say, this is what this level means. And this is what we can do about it. I think it's a brilliant way. It makes it more. We always say in healthcare that we're patient focused, yes, but this really does mean that it is patient focused and we're two-way streets. But I'm glad you're enjoying that part too. Yes, handwriting is different than EMR, right? Coming from typing versus handwriting. My handwriting's really small.
Mine is large.
Yours is,
I don't have enough room.
But yours is super readable. Dan's is like reading the Rosetta Stone.
Yeah, mine is nicely readable. I came from orthopedics in the world where we're dragging our feet going into anything that could slow us down. So we were still dictating everything. So we weren't really having to sit and type. So it was pretty quick actually. That's
great.
Because you're dictating and it transcribes. So even writing doesn't seem too far removed for me. So it was actually okay.
Well, that's great.
Yeah,
you know what?
I welcome it.
Handwriting is not too far removed from any of us, right? Let's not make it a lost art, right? I feel like everybody's just typing.
Cursive is already getting lost, I think. Right?
It's not taught. I say that I don't have kids. You tell me.
Well, Fletch, I feel like my son did have like a little like an introduction, but they don't continue to use it. So he can't read. Like if I write a note to him in cursive, he can read only a few words. So I have to remember, because I typically do write in cursive versus printing.
Yeah.
And sometimes it's mixed, right? A few words.
Yep.
So I have to remember, he can't always read what I write
it's
in
so
cursive.
Interesting.
Yeah.
It is interesting. Oh, how the times have changed.
Oh, yes.
Oh, how they changed. But so it's, you've had such an impressive career, an expansive career, a personal history that just totally melts into the mix of performance medicine. You'll be very lucky to get an appointment with Jill. So please, our patient population is begging to see you. So Jill is accepting patients. Bristol is open. We're having a grand opening. I don't know if you can see this behind us, but this is our grand opening poster, May 6th, Friday, day after Cinco de Mayo. Yes. I literally almost said Mardi Gras. The day after Mardi Gras next year, we'll be right. No, May 6th, Friday. It's going to be a big open house. The space, I don't know if you can notice, is very beautiful. It's posh. I feel like if we were the Spice Girls of performance medicine, this would be Posh Spice.
I think you're right.
I think Johnson City's Baby Spice, right? We're all a little young there.
Yeah, that's true.
Bubbly. Kingsport. Well, obviously, Robin with red hair, they should be Ginger Spice.
Yes.
So Robin in the Knoxville Clinic would be Ginger Spice. Kingsport, I guess, Sporty Spice? Scary Spice? I don't know. Maybe a little Scary Spice. Maybe. Throw a little bit in there.
They have so many providers there and so much going on, and they could just, all the rest of the spices could be there. Any spices that are left.
The entire cabinet.
Yes.
I think they're going to kill me for doing a Spice Girls reference right there, but that's okay.
Oh, that's funny.
Well, we're so lucky to have you. And really, we're lucky to have you, but patients are lucky to have you too.
Thank you.
Make your appointment now. Know too that we can talk about bones, right? We can talk about diabetes. We can talk about thyroid. We can talk about gut. We can really talk about anything. But I love how you said that we kind of have every provider that you see at performance medicine, we all can do the same things. We all have the same, but we all have these little arms out of it. It's almost like an octopus with little tentacles coming out. We all have these little specialties that just help you to say, sometimes maybe you don't have to go to a specialist. Maybe too, you can get a different idea of what you may be going through. And I think now it's going to be all about the bones. Right?
Yes.
All about the bones. Okay, perfect. Well, I'm excited for you. I hope you're excited.
Thank you. I am excited. I'm glad to be here. I appreciate the opportunity.
And patients, get pumped because it's Bristol, baby. Come see us on May 6th, and come see us every day.
Don't go away.